wide-ranging of reflections and viewpoints today. So we hope that'll keep you energized and engaged this afternoon. This session is really designed to reflect on and appreciate USAID's 60-plus years of contributions to the family planning space and the broader sexual and reproductive health and rights field. We all know and acknowledge that USAID was not perfect. No institution is. And we also know that its dismantling over this past year did a massive amount of damage to health systems, supply chains, clinical services, community programs, livelihoods, and more. But we also know as a certainty that this ICFP community continues to contribute massive amount of good in the world with many of the resources, strategies, lessons, evidence, thinking, guidance, ambitions that were part of USAID and part of USAID's legacy. And that is what we are here to acknowledge and appreciate today. So thank you for joining us as we do this reflection and talk about how we move into the future with what we know and what we've gained from USAID. One of the first sexual and reproductive health and rights projects that I ever worked on in my career, it was 30 years ago, was managing an operations research project that was designed to demonstrate that midwives would be appropriate and effective providers of manual vacuum aspiration for post-abortion care. Now, if this sounds quaint, realize this was 30 years ago. Obviously, midwives are exceptional providers of MVA for post-abortion care, but it hadn't been documented at that point. And we did that project under the USAID-funded Mother Care Project. JSI was the prime. And it was an opportunity for me to start seeing how USAID was helping generate evidence to push practices into new directions, to make services more
que los
accessible,
servicios fueran más asequibles.
to deliver the kind of health care that people need in the world. Since I joined Engender Health 7 years ago, Engender Health has been an implementing partner, was an implementing partner with USAID for 50 plus years. So I had the privilege of working with teams on USAID projects, working on safe surgery, on contraceptive access, gender-based violence, maternal and newborn health, HIV, and more. And these integrated projects, in some way, they just recognized that the training, services, and care can be comprehensive. That was, to me, a core lesson of USAID, that even if a project was going at something from a direction to demonstrate a point or add value or take something to scale, we were constantly integrating across sexual and reproductive health, across global health, across health areas and work streams. So I learned so much and have been so inspired by these projects from 30 years ago and today. And we continue to take those lessons into our other work. USAID has also given me some deep connections and friendships in this sector. And I think one of the things USAID will remain known for is its people. People who worked for USAID, people who worked with USAID, all of its implementing partners, government collaborators, and others. And one of the people that I met almost 30 years ago in my first forays into reproductive health work and working with USAID was Pop Guy. It was thanks to another USAID project that IntraHealth was implementing that we met. So Pop, I'd love to invite you to share some of your reflections on USAID's legacy.
Thank you. Thank you, Tracy. And that's a very, very good place to start because it is the work that the agency has done, but it is also the people and the connection, especially the people and the connection. I was honored and excited to participate in this opening, invited to make opening remarks for a variety of reasons, but I was hoping that my testimonial could be meaningful in that I can say that I also represent folks who are in this room and many who are not here but whose lives has been so impacted by the agency, by USAID, and by this community. I can say personally that my professional life has been shaped by the work and the opportunity to work in this area. When I graduated from UCLA and was contemplating what to do, and I got a call from the University of North Carolina, who was running a program, who told me that they were looking for somebody to start their operations in West Africa. Not only was it just perfect because I was having an opportunity to go back to Africa, but I did not know it was going to open a whole field that I knew so little about. And I think I'm known in the field as a champion in global health, in reproductive health, and all that. It was facilitated by that. And Tracy just shared this example of how we met through the work of USAID when we were covering Ghana. We were doing a work together in Ghana. All that to say that I am so glad we put some time during this conference to take a moment to have conversations, to reflect. It's not so much about the agency, but it's about the work of the agency, the people of the agency, the work and the impact this agency has had on so many lives around the globe. I am a big champion of global solidarity. I dedicated my entire life trying to understand people, to connect with people, because I think once people are connected the right way, that's where changes start to happen, and that's where progress starts to make, because that whole saying of making the world a better place, then we start feeling it. We start giving meaning to what we do. And I think that's the type of thing the work of USAID has meant to us. I think beyond the politics, beyond the errors, beyond the choices, I would do it different and so forth, if we just hang on to this, if we hang on to the power of connection, to the power of people, I think we will be so much ahead. So I just wanted to share my excitement and my deep appreciation for having given the opportunity to embrace this field and to join colleagues like you. I like to say that we all could have chosen work that is much, much easier to do than the work that we have chosen to do. But it takes special people to do this work. So I want to take this opportunity also to thank you. You are here because you care. You are here because you care about the work USAID has catalyzed for us. And I look forward to more conversation, and I look forward to leveraging this wonderful gift we were given by this agency, which was so unjustly dismantled, but that's not going to stop us, because the challenges are there, the challenges remain. But I am convinced that if we continue this movement, we will be able to face it, and we will be able to surmount all the obstacles and do make this life a better place. I thank you.
Thanks, Pop. We'll excuse Pop for a few minutes. You'll see him again. And I want to introduce the three fantastic colleagues to my left. This was meant to be a panel of 4, so I'm also going to refer to our 4th panelist, who's, despite having multiple visas and transit visas, was still turned around and wasn't able to be here. But first, let me introduce Ann Fitzer. Ann is a global health leader who's served almost 30 years at JPIGO implementing USAID projects, most recently as Director of Family Planning and Reproductive Health for Momentum. Her broad and deep sexual and reproductive health experience is now benefiting the Advocacy and Accountability Collaborative, expanding impact in global health in Africa and India. Next to Anne, we have Nora Quesada. Nora is a supply chain expert for public and private sectors whose professional career spans the design and implementation of commodity security strategies, family planning and reproductive health programs, and financial and technical sustainability plans for USAID-assisted countries. And next to Nora is Dr. Sheila Nyawira Macharia, who's the Managing Director for FP 2030's East and Southern Africa Regional Hub, which is advancing family planning across 22 countries in the region. Sheila was at USAID Kenya and East Africa, where she was the Family Health Director until 2020, leading the program covering family planning, reproductive health, maternal-child health, and all. And I'm sorry that Manisha Thapa can't be here. She's a program lead for Unity for Change, a youth-led organization working for sexual and reproductive health in Nepal. And we knew a couple days ago she wasn't going to be here, and we had a moment of thinking about whether we bring someone else in. But I was reminded, and it came up again yesterday in a panel where our colleague Goodness said, youth shouldn't be a quota. Having young leaders is not a quota. We're not the same. We're not plug and play. And so to say that, one young leader is not on this panel, we'll just bring in someone else. But it was Manisha who should be here. So rather than try to recruit at the last moment for another panelist, I have a message from Manisha, which I'll be sharing in a few minutes. But first, I'm excited to hear from these fantastic colleagues whose careers have been not just shaped by USAID, but who have shaped USAID through their careers. And you spent almost your entire career to date, not over yet, linked to USAID programs, and you were involved in some of its seminal work. So let's get right to the point. How have USAID-supported projects expanded access to contraception and other aspects of sexual and reproductive health, maternal health, et cetera, over the past decades?
Thanks, Tracy. And I think, like Pap, I'm very honored to be here and representing so many colleagues in the room who've worked and given their careers to USAID, whether it was a few years because you're younger, or a little grayer like some of us and given a few more years. I started in 1990. I've worked for two big INGOs, and I have to say, I'm very proud of the work that we did. It was grounded in evidence. And so I ask all of you, how many of you, raise your hand, have also worked for USAID or done work supported by USAID? Look at that. Now, you should be proud of all the work. We're reflecting on the loss, but we're also celebrating the accomplishments in this session. And what, for me, really resonates with everything that I've ever done with USAID is that it was grounded in evidence. And some new evidence came out in June of this year in the Lancet study by Cavalcanti, right, that looked at the impact of USAID across 133 countries and disaggregated by level of USAID support. And that study estimated that USAID contributed to reducing 91 million deaths, and a third of those were among children under 5. Now, you have to know that access to contraception, the task sharing that we saw in the video that was shared, the upskilling of clinical health workers, everything that USAID has done in the family planning sector contributed to these maternal and child mortality and other adult mortality reductions. And one of the areas that I've spent the last 10, 12 years working on has been that integration of maternal and newborn health. And I look around in this conference, and it's a very common topic. But when I came back to USAID work in 2012, it wasn't as common. I was working for an integrated maternal and child health project, and I had been I came in after USAID colleagues had shown great leadership to work across offices and put together funding to relook at data that had been collected in operations research studies in Latin America, in the 90s and showed the value of integration of postpartum and post-abortion family planning. And the evidence, we generated new evidence, or they, before I came, had generated new evidence, but it was not yet being implemented at scale in all the countries that needed to implement it. The evidence showed that postpartum women were not totally well served by the existing family planning programs and the way family planning was structured. They had fears about using hormonal methods during breastfeeding, or they didn't understand the return of fertility could precede return of menses. So all that evidence was out there, but we needed to get it into the ground and at scale. And some great leaders at USAID, at the Gates Foundation, we worked with them and WHO to first update the medical eligibility criteria and then have a series of convenings. In fact, Engender Health hosted one of those in Dar es Salaam, but before that, we had one in Chiang Mai. And then we had another one in Mexico City that was at the Integrated Maternal and Newborn Health Conference. And we really worked to bring together ministries of health, professional societies of OBGYNs and midwives, civil society, implementing partners to come together and say, how do we take this to scale? One of my colleagues who will be on this stage later talked about the rolling thunder to not just meet, but also keep following up on the actions that people had identified. So to me, that is an example of how USAID could bring together multiple projects and multiple other donors and be a catalyst for change and for scale. Today, postpartum and post-abortion family planning are way ahead of where they were then. HIPs have been written, indicators have been integrated into health information systems, and ultimately it's been this like working in harmony with government, with local organization, with each other, that has made a tremendous difference, I believe.
Thanks, Anne. Thank you. And that's a huge remit, right, already that your review that USAID has done. But Nora, when we spoke last week and thinking about this panel, you referred to the mantra that many of us know so well, no product, no program. So all of these things Anne's talking about, postpartum and post-abortion family planning, okay, what about the product? Tell us a little bit about some of your supply chain work and how USAID has helped build that system.
Thank you, Tracy. I had the privilege of working not only in Latin America, but in different geographies. And when you think about the USAID legacy and think about the health system strengthening, if we understand health system strengthening as the process of improving the ability of a country's healthcare system to provide quality health services and respond to health challenges. Basically, components like leadership and governance, health workforce, health financing, service delivery, medicines and technology, and health information systems. That takes me back to the late 1980s when countries didn't think about the importance of supply chain management. They were receiving donations because at the time, most of the countries relied on international assistance, and USAID was the main donor. Thanks to the population programs from USAID, countries and women had the opportunity to access to family planning products at the time. But they didn't know how to deliver the products to the last mile. And then we started through the different projects. I had the opportunity to start in the first FPLM project, dedicated to family planning logistics management project, and to start working with governments and NGOs throughout the different geographies to make them understand that it was important to have a health information system, it was important to have a health logistics management information system, protocols and so on, and also a cadre of people who could manage the information system, who could manage the supply chains so that the products could be delivered to the women. and that's, and USAID, I would say that my whole professional life was shaped by USAID. Everything I am, I owe it to USAID and to my family and the people that I had the opportunity to meet through the different projects that I participated in, through the different people that I had the opportunity to work with and to build these supply chain systems throughout the globe. So I wouldn't think of strong supply chain management systems now in many countries without thinking about the importance of USAID projects that shaped the different supply chain systems across the globe. Thank you.
Thank you so much, Nora. So programs, products, and then Sheila, you were with USAID at country level, and we are going to hear from a panel about sort of country impact of USAID projects, but you have a lot to share specifically about how USAID engaged with governments. So tell us a little bit about that. That was one of the main, ways of working that USAID did for so many decades. Share a little bit about your experience.
Sure, thank you very much, Tracy. First, hello, everyone. Hello, my friends from USAID. It is such a pleasure to be here. For anyone who knows me, you know I loved working for the agency. I just loved USAID. There was no question. And I'd like to honor my colleagues from USAID Kenya and East Africa through the years. Allow me to make a particular mention of Scott Radloff, who mentored me and gave me a love for public health, and my first health officer, the late Janet Paz Castillo. At USAID, I learned a lot because I was director of a large program, family planning, maternal, newborn, child, and adolescent health, water, sanitation, hygiene, and nutrition. And that meant you also worked with the PEPFAR program, you worked with the PMI program, you worked across a whole of government approach. I worked with the offices that dealt with water, the agriculture office, democracy and governance, because we did lobbying with parliamentarians and politicians across. And then we also worked across the region and then globally. USAID was very careful to align with national strategies. So a lot of the work we did as USAID and our partners was to understand the government's strategies, national and regional, and then align our strategy and our plans alongside government. The systems we support have been mentioned. The joy was to go to communities and see transformation. We would work with women who would set up vegetable gardens, and in that group, not only would they learn the best nutrition to give their children, but they'd also have access to information about family planning and antenatal care, labor and delivery, and postpartum care, and economic empowerment. We went to pastoral communities where our partners got innovative strategies to support health services by following the pastoralists as they migrated, set up camp, and offer immunization, family planning, antenatal care. We worked with the veterinarians to have integrated outreaches. So they'd be injecting the camels and taking care of the goats, and we'd be giving health care, and there would be registration of babies and IDs given. We improved the quality of contraceptive counseling and family planning services. We procured contraceptives and had them distributed through the national warehouses. We bought equipment for newborn care, like newborn resuscitators, delivery kits. We bought supplies, ancillary supplies for contraception. And as I said, we lobbied with parliamentarians to get budget lines for family planning. We represented on the global stage the progress that was in our countries and had the joy of being in Indonesia when, for instance, Kenya received an award for having made such strides. It was wonderful working with government, aligning with their program. And as I said, working the PEPFAR program, oh my goodness. Wasn't that something else? Goodness, data, 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 site improvement, every minute of the day. And PMI, the long-lasting ITNs and getting the medicines out. So it allowed us to work across government with traditional leaders, faith leaders, private sector, and with other donors. We co-finance social marketing with FCDO, the British government, and many others like the Grand Challenges, etc. A lifetime of influence. And I was an FP 2020 focal point. And I loved FP 2020. So when FP 2030 came, aloha, here I am.
Thank you, Sheila. In just a moment, I'm going to invite each of you in less than a minute to pull out your crystal ball and let us know what you see in the future. But first, I want to share a message from Manisha Thapa, who flight pattern didn't facilitate her getting here this week. And maybe she's online. She's in Nepal and the timing isn't great. But Manisha Thapa is a young public health professional from Nepal and an ICFP Youth Trailblazer Award winner. She began her public health career working on a USAID-funded project, advocating with provincial governments in Nepal to address youth contraceptive discontinuation in provincial health policies, a staggering yet largely unaddressed issue. For her youth-led organization called Visible Impact, it was a milestone, and it marked their first collaboration with the government, facilitated by USAID. Since then, their organization, Visible Impact, has built strong rapport and worked together on various sexual and reproductive health and rights initiatives, including orientations, capacity building, values clarification, and more. And today, the government in Nepal increasingly trusts and supports youth-led sexual and reproductive health and rights initiatives through this journey that started with leading the USAID project back in 2022, through which she developed the confidence to do this work. So USAID's project had an enormous impact on Manisha. We heard that when we spoke with her a week or so ago in preparation for this panel. And their project, and that with the confidence that they're taking forward, is having an influence on their relationship with the government of Nepal, and youth sexual reproductive health and rights leaders are now having much more influence with and for the provincial governments. It's a powerful testimony to the impact of USAID on a critical person in the next generation of our work on reproductive health and rights. So thank you, Manisha, we miss you. Okay, so the future, a minute or less, your plans or your vision, what you're seeing in your crystal ball. USAID has ended as an institution, but we know this work continues, right? During our prep call a couple weeks ago, Nora, you said this is unstoppable. Okay, you start. What's unstoppable? What are we taking forward?
Yeah, we're unstoppable. The ball is rolling and we cannot stop it. We shouldn't stop it. When I was talking to Tracy a couple of weeks ago, I was telling her that everything that we did under the USAID projects, we never created or reinvented the wheel again. I would say that we built on what was working, and we also looked back and saw what hadn't been working well, and built on that to make the systems stronger every time. So based on those experiences, organizations or multilateral banks like the Inter-American Development Bank, the World Bank, had taken those learnings from the USAID projects, from what the projects did in supply chain management, and are implementing that in their projects nowadays. So they are not reinventing the wheel again. They are really building on what the USAID legacy is at this point. Also, during the projects, we also created the commodity security strategies, and countries and governments came together with NGOs and other partners in countries to secure commodities for family planning. So those legacies still continue, and we hope they will continue with the generations to come, and also because what we did under the USAID projects works and stays and still works. Mexico is one of the examples. Nicaragua is one of the examples. Indonesia, and I could mention many countries. Of course, there are still challenges. We need to continue improving the systems, but we are unstoppable.
Thank you, Nora. Anne, in less than a minute, you've got a crystal ball too. What you got?
Well, I'm going to go back to the crystal ball in like February, March, and it was very dark. But one of the initiatives that had always inspired me in the last 5 years of Momentum was led by my colleague Angela Mutunga, who worked on an initiative that was actually a vision of Duff Gillespie from the Advanced Family Planning Program. It was called TAC. But she had grown it and evolved it and got additional support from UNFPA and the new partnership initiative and core support from Momentum, and then some field funding. And it brought together, again, this idea of collaboration. It's the advocacy and accountability collaborative, and it brings together civil society as stronger networks who work, are more effective when they're stronger together, when they're networked, to work with or sometimes to hold their governments accountable for the commitments they've made to deliver stronger health and stronger health services for their communities, health systems and services. So she called me in March and said, this work needs to continue. What do you think if we form an NGO? So we did. So TAC is now registered in Kenya, but we are still in touch with our 7 collaboratives in India, Cote d'Ivoire, Burkina, Sierra Leone, Zambia, and Kenya, and Tanzania. And we'll accept more. But we're hoping that we can, and her energy and passion for working together can continue into the future in this new day, new age, where more than ever we need people to align together. So that's my hope, if not my crystal ball.
Thank you, and bon chance. That's wonderful. Sheila, you get the last word. What is your crystal ball showing you? What's our future?
First of all, I'd like to honor my fellow Foreign Service nationals around the world. Well done. Well done. We have impacted our countries in ways that history will tell a story. I also want to honor our USAID personal service contractors, our direct hires, and all the different mechanisms, and our implementing partners. Thank you. And to the American taxpayers, there's no doubt that your resources have really gone a long way all over the world in different sectors of development. Having said that, I'll say this: never again should any country be so reliant on a single donor. It is time for sovereignty. It is time for countries to continue to shape their own destiny. Yes, to get partnerships, and partners need to work not in, but alongside governments. And the future is young. So let's see what these young people who call themselves Gen Zs and Millennials and Gen Alphas have for us. The future is theirs, and I know that they'll do great. Thank you.
Thank you, Sheila. Thank you to this panel. And I'd like to invite up and introduce Monica Kerrigan, who's a managing director with Family Planning 2030, who's going to bring up another panel and introduce them.
Thank you all so very much for being here. I want to call up our panel. We are going to be talking about country impact, and really we have a wonderful group of people. Marie Ba from the OPCU, Executive Director, come on up. Mohammed Abu Nar, the COO of Pathfinder, please come up. Natasha Keoma, she's the Executive Director, the CEO of Copper Rose Zambia, and Mukesh Sharma, the CEO of PSI India. Thank you for being here. I just want to say a few words. My name is Monica Kerrigan, and I served at USAID for 10 years. 6 years in the Office of Population and Reproductive Health, 4 years at USAID Indonesia. Today, I am touched and moved. It's been a tough, tough year for all of you. And this is a celebration of the legacy, and so we'll be talking about the impact that each of you and our partners have made around the world. So I'm going to start with Mariba, because it's exciting to think about the regional partnership. She works so closely with USAID setting up the Ouagadougou Partnership and the 9 countries. So in this regional partnership, Mariba, what is USAID's legacy and key accomplishments? Thank you.
Thank you. Thank you so much. And it's a real pleasure to join this conversation on the impact that USAID has had on sexual reproductive health, particularly in our region. When we talk about the history and the progress of family planning in our region, it's impossible to not mention USAID. The OP actually is a legacy and a testament of the work that USAID did. USAID was at the origin of the creation of the Ouagadougou Partnership at FP 2020. And actually, in our core set of focal points, we were lucky enough to have, and I think that was one of the most efficient ways to support the Ouagadougou Partnership, is that we had support at the international level, the global level, with the Office of Population in Washington, D.C., but also the regional office in Accra, and then support from each of the 9 countries as well. And that has been instrumental in some of the success that the OPCU and the OP were able to build. One thing that always stood out and that was mentioned in the previous panel was how complementary the work that USAID was doing with the local policies, local governance, but also with other donors. I have several examples of donors' caravans where we went in country with multiple donors, and USAID was really the backbone, showing us the way, what was being done, how to improve it, and just fostering collaboration with other donors. So there's several examples where after visiting a country, there were joint programs or other donors just shifting their investments based on what we saw on the ground, and USAID was able to showcase. Beyond funding, I know we talk a lot about figures, numbers, money, but beyond funding, I think especially for us at the Ouagadougou Partnership, it's the influence and the advocacy. Pairing up USAID and the State Department, every time we went into a country, you have no idea how much more access we had because of USAID and the State Department that sometimes even local decision makers didn't have with the higher ups and the authorities. So that was extremely helpful during the caravans, during the annual meetings, when we were meeting with local authorities, to have USAID with us, to have the US ambassador with us also. And I think USAID also gave a lot of power and a lot of grounds to the State Department. And I don't think we can overlook either the role of USAID in evidence building and data. The DHS, all of these tools that our countries are now missing, but we're using to base some of the decisions that we're making around family planning. And we already have enough issues around data collection and data quality that I think that the gap is widening, and so we're looking for solutions about that. But that was a great and wonderful contribution that USAID made into this region.
Thank you so much, Marie. And wow, what a difference, When we think about the partnership, and it continues on today because of USAID, and I want to give a big shout out for the people who have worked so hard in those 9 countries in the Sahel and at the Global Bureau. It really made a difference, the support that was made. And Scott Radloff, another shout out to you, because you were one of the ones who really kicked off the Ouagadougou Partnership with the government of France. So now I'm going to turn, we just heard from the Sahel. Now we're going to turn to somebody who's worked on several different USAID projects, and that's Mohamed Abu Nar. He served as the chief of party in Egypt with USAID over 2 decades. And we're curious to hear what were the major achievements and what systems continue today thanks to USAID investments.
Thank you very much, Monica, and hello, everyone. This is a very emotional panel. And before I start, I really would like to thank each and everyone who worked either in USAID or in any activity related to USAID or funded by USAID. They worked tirelessly across the globe in the very hard-to-reach countries and areas, leading amazing work, I can say, and strived hard to leave us with a better world. So thank you to each and every one of you. This is my first thing. I started by managing USAID project since 1997. I was 5 years old, guys. I'm not that old. I worked in economic growth, trade facilitation, education, quality assurance, and for the last 22 years, I've been working with Pathfinder on global health, family planning, reproductive health projects and programs. I managed many mega projects, starting from Population 1, 2, 3, 4, Tahsin Catalyst Program, and lately, we just closed, unfortunately, 2 flagship mega projects. One of them was an integrated family planning reproductive health project called USRA. And USRA in Arabic means family, and this project was implemented in Egypt across 10 governorates in 625 communities with a reach of over 10.5 million persons. Again, we can never deny the lasting impact of our projects and USAID programs in Egypt. Very quickly, like a cut of 80% of maternal mortality. More than 70% decline into child mortality. This is big. And when you look at one project that unfortunately we had to lay over 150 persons in the middle of a project being jobless after working in the very hard-to-reach areas in the communities. But this project was a brilliant project because USAID worked with the governments to identify, to ideate, co-create, and understanding the local context, what the people in the communities need. And here came the design. And here we're implementing an integrated approach. We are a community-centered organization. We listen to what the communities want, and that's what USAID was always doing. We implemented an integrated approach because the communities wanted integrated approaches. So we integrated family planning with reproductive health, with private sector engagement, working with the government, building local capacities, which is very important. Again, this is the legacy that USAID is leaving, like local entities, local civil society organizations that are capable to continue after the funding is over. Sustainability for us was like a transfer of know-how process. Again, positive youth development, community mobilization, transformational leadership. With all my respect, even the WHO in their health system strengthening building blocks, we're looking at leadership from a stewardship perspective for countries, and they forgot the human factor. And this was the USAID integrated design in this project. Again, every time we go into any of the communities, they just remember USAID programs. They just use the tools we left, either at the Ministry of Health or the Ministry of Social Solidarity or Ministry of Youth and Sports, because we worked on transformation and we worked on social behavior change, which was so crucial. I'll stop here. Thank you very much.
Thank you very much, Mohammed. Wow. We heard from Mohammed about that real impact, that sustainability, the systems building, and the technical expertise that USAID brought. Just amazing and profound. And that's thanks to each one of you. We're now going to turn, and you had mentioned it, Mohammed, about local leadership. And, you know, in so many respects, Natasha represents that. I want to give her a big shout out as the CEO of Copper Rose, a Zambia local CSO organization. Let's hear it. Come on. Woo! She partnered very closely with USAID. And Natasha, we'd love to hear from your perspective, what are the key successes of the legacy of USAID's investment in your organization and in yourself?
Thank you so much. So just like Mohammed said, speaking about USAID is emotional because for us at Copper Rose, we are a youth organization based in Zambia. We had 6 sub-awards with USAID, and we were preparing to prime on a project which was forecasted to on the 15th of March. So for us, it felt like you have been dating this person, you are courting this person, and you're about to get married, and he dies, literally. So for us, but I mean, I want to share more about the successes and things that were exciting. For us at Copper Rose, we worked with USAID not in only one portfolio, but we interacted with various portfolios. So we worked with the reproductive health team, the gender team, as well as the HIV team. We worked on the DREAMS program across the country, and our role as Copper Rose was adolescent boys and young men. And we were reaching more than 25,000 boys during the course of the program. We worked on the family planning and nutrition program, and we were doing technical assistance, providing technical assistance to government on adolescents and young people. In the HIV space, we were doing a lot of demand creation and service provision. In 2024 alone, we reached more than 200,000 young people. We provided VMMC and cervical cancer to more than 13,000 young people. We were working on preventing mother-to-child transmission for adolescent mothers. And we also worked on pediatric HIV, finding young people in schools and children in schools. We also employed more than 300 people on the ground. But one thing to remember is that USAID allowed us to integrate, because while most programs come with only one focus, and most organizations that are prime organizations will have one focus, us having that many sub-awards allowed us to integrate within ourselves. So the team that's on the DREAMS program with the boys would coordinate with those that are on the HIV prevention program, and the same boys would receive voluntary male circumcision. With USAID, we were also able to increase youth leadership and participation, which we continue to see in our communities, because we were working in around 400 communities and more than 50 health facilities. So we built youth capacity to lead, and we integrated youth in the neighborhood health committee structures. Overall, I would say that USAID allowed us as Copper Rose to scale from working and reaching 20 to 30,000 people annually in around 2019 to reaching more than 200,000 a year directly. And if we count our social media platforms and social media engagement, we were reaching around 800,000 indirectly every year. In the previous panel, there was a talk about systems. We had an opportunity to strengthen our internal systems. USAID partners took a bet on us, because often when we think of a youth organization, we are thinking of $10,000 grants, $20,000 grants. But with USAID, we were able to move and become a multi-million-dollar youth organization, which is something that you rarely see on the African continent. So our increased capacity and credibility allowed us to provide leadership even in other spaces outside the health system. I could go on, but overall I can say that USAID allowed us to build integration, scale, leadership, and sustainability, because until now, Copper Rose is still the partner you think of when you're thinking of adolescents and young people. Their partnership transformed us from implementers to national leaders in youth health and development. And it's funny because this year we just got a new website and we called it copperrose.africa, because we're thinking about Africa work. And looking at the current funding landscape, we have no idea how to pull that off. But we still have that as our website, and we can't wait to see what we'll be able to do. Thank you.
Thank you very much. And something that Natasha reminded me of is that, you know, USAID, some of the things that, some of the key principles, voluntarism that you mentioned, leaving behind building systems, building leadership. And Natasha, and I think everybody should check out Copper Rose on their website, and I'm looking forward to looking at it myself. Now we're going to shift to something, and I think that's been so pioneering about USAID, and that's the private sector. Super excited, Mukesh, that you're here today. He's worked closely with USAID in India on many projects, but I'm having him focus today on the private sector. And USAID was one of the frontier funders and pace setters in this area, Mukesh. What were the key accomplishments that USAID advanced in India in the private sector?
Thanks, Monica. And during this discussion, I went back 23 years back to meet another Mukesh who started his career with USAID-supported integrated nutrition health project in India. So that was the beginning of my career, and forgive me if I become a little emotional, because the entire career was mostly with the USAID-supported projects and programs. And at many of the places, I also led some of the programs supported by USAID in the country. As Monica said about the private sector, so before that, I would like to request all of you to keep one small family in mind, one husband, wife, and small kid, maybe in a remote village, hard-to-reach area, or urban slum, or vulnerable slum population. I will come to that at the end of the narration. So my experience learning with USAID-supported projects and leading USAID projects is mostly towards learning, actions, impact, emotions, and so many other things, because with years and years, I used to work with them. So far as private sector is concerned, Monica, before going to the private sector, be it health system strengthening, impact bond, policy support, research, monitoring and evaluation, USAID was always there in the country to support government and to support local stakeholders in the country. So I will put two examples quickly, because time is running fast. So two examples related to the private sector, so how USAID supported Government of India and the stakeholders in the country. First, you must have heard about the DIB program, DIB, which is Development Impact Bond. So this is a very innovative project USAID started in India, and many of the partners were there, Palladium, PSI India, and many more. And the aim was to help private sector to be equipped infrastructurally and to have quality certification as per the Government of India norms to provide quality health services, and best part is to have quality family planning services. Thousands of private sector providers were certified under this program, and it is still gone. It is still on. It means the investment that USAID made, it is still on, and the private sector is providing quality health services and family planning services, and became an extended arm of government. Second example is related to the policy support which USAID did. You must have heard about National Rural Health Mission, which Government of India started in 2005. And USAID supported very actively to design and conceptualize that National Rural Health Mission with Government of India, and it was across the country. But the name was National Rural Health Mission, so entire focus was towards rural area. And USAID started doing the piloting and started establishing proof of concept with local stakeholders to see that how, if we work in urban areas, how it looks like. And many projects were there, like environmental health project and many more, to see and show that how urban population is also important, because the health indicators were really, really on the lower side in the urban areas, especially among urban poor and all. In 2013, National Urban Health Mission was launched by Government of India, and USAID was very active to support Government of India with some other stakeholders in the country. And after 2-3 years, this National Urban Health Mission was subsumed with National Health Mission. But the best part is, and we all know that in India, most of the private providers are there in the urban areas. Over 80% of the private providers are there in the urban areas. This platform provided Government of India and private sector, Federation of Obs and Gynae and Indian Medical Association, to get connected with the government, to get accredited with the government, to get empaneled with the government, to provide family planning services specifically. I will give an example from Uttar Pradesh, where USAID supported SIFSA, became the public-private interface agency in the state, and helped more than 1,000 of private facilities to get accredited with the government norms, more than 800 private providers to empanel with the government norms, and in 2.5 years of span, they provided around 350,000 women and men received family planning services from the private sector with zero cost. And government reimbursed $17.5 million to the private sector under a strategic purchase scheme to provide services to the urban poor and rural poor. So if you ask me, if you see the data, urban family planning MCPR is 58.5, little higher than the total MCPR in the country, which is 56.5. And there was USAID role in this to put government on the driving seat, to put government on the, scaling this up with the private sector infrastructure. So I personally feel that USAID support was very much there and ensured that both qualitative and quantitative results should be there, and it is there. And now coming back to those family we discussed in the beginning, think about that. They are happy, they are satisfied, they are healthy, and if their smiles are matching with our smiles, it means it was the real support by USAID with government and other stakeholders to them. So thanks to all the persons who worked with USAID, thanks to all of you who worked for USAID, and thanks to all of you who worked in any of the projects supported by USAID, and thanks to USAID. Thank you.
Thank you so much, Mukesh. We have just 1 minute to go. The last question for our lightning round was for each one of our participants, our panelists, to tell us one word that describes your experience working with USAID. Let's kick it off, Mariba.
Sure. I would say strength, because in many ways, I feel like USAID carried us on their backs. And so there are so many connections were made through USAID, people inside this room to people outside of this room. It's also this very strong, powerful machine that integrated health, education, agriculture, governance, and linking all of those together to make a lasting impact. So I would say strength.
Beautiful. Mohammed.
Thank you very much, Monica. And actually, I have more than one word, to be very honest.
Oh, we have 58 seconds.
Yes, I'll use the 1 minute. First of all, it's partnerships. Again, nobody was working alone. We all worked in partnerships. Second, community-driven solutions, which respected the local context. Third, and this was very important, is the local capacity development. And I think we all worked to ensure that we leave something behind through a transfer of know-how. Thank you very much.
Beautiful. Thank you so much. Natasha.
My phrase, I can say phrase, even though you say the word. My phrase to describe USAID is fairness and transparency. USAID's process was predictable, fair, there was a forecast, people submitted bids, people won the bids and started executing and rolling out projects. But now, with the partners that we have, we don't even know when the call is out. There is no call. It's about who knows who. And as local partners, it's really, in the global south, it's a very, very big jump for us. So I would say that USAID was fair and transparent.
Thank you so much. Mukesh.
Yeah, I mean, their long-term partnership with the local entities, they were fully aligned with the country government strategies, and they were very much focused on both qualitative and quantitative results.
Thank you so much. I'm going to say one word for myself. USAID was my family. Even after I left USAID, you were my family. You connected me. You gave me passion. You gave me purpose. You gave me a whole career. And I was so grateful. Even before I started working with the agency, it was the people who were at the agency who were kind of helping support us all. And I just want to thank each and every one of you for your service, for all that you have done for us and the world. And now I'm passing it on to some of those great people. Shaimi, come on up here. Come on, Madeline. Let's go. Pop. And we are going to leave the stage. Yes, thank you. Thanks to our panelists. A big round of applause. Woo!
So this conversation would not be complete if we didn't hear some thoughts from within the institution. We've heard a lot of the people who've been partners, who've been influenced by the agencies, who've benefited from who are implementers, collaborators. To wrap up our conversation, I have the pleasure of introducing Shaimi Da Silva and Madeleine Short. Shaimi has been the office director, and Madeleine is the deputy director. And I am personally dying to hear their perspective on this, because I think it's a very different viewpoint when you are actually within the agency. And so to help us just close this wonderful conversation, I'd like first of all to give them an opportunity to introduce themselves, and then we'll come back for someone. So who wants? Shaimi, go ahead and start.
Is this on? Yeah.
Yes.
Okay. So thanks, Pop. Hi, everyone. It's lovely to see so many people here. I'm Shaimi Da Silva, and prior to the dismantling of the agency, I served as the director of the Office of Population and Reproductive Health in Washington. And Madeleine served as a deputy director in that office. And I think before we dive into this part of the panel, I think we want to be clear that we are both here in our personal capacities. We no longer work for USAID or the US government. And so we're going to offer you our personal reflections on what we heard in the previous two panels. Madeleine?
Hi, I'm Madeleine Short-Babick. Like Shaimi said, I, until July 1st, was working with USAID. I was proud to be Shaimi's deputy in the Office of Population and Reproductive Health, and I'm really grateful to have the opportunity to be here today. I'm grateful for the panelists for all of the beautiful things that they said, for the folks who participated in the survey that we sent out through different channels, and hundreds of people responded, and what they said was really beautiful and touching, and you'll see a few of their quotes as we're talking. I'm also really thankful to the Gates Institute and ICFP for giving space to celebrate USAID and to appreciate all of the folks who worked for USAID and with USAID, and thanks especially to Tracy and Monica for pulling all of this together and using your precious time in this way. I think the other thing I'd say, just while I'm introducing myself, is that we are here. I think we're here on behalf of our teammates. And when USAID was shuttered in January, February of earlier this year, there were 150 folks working around the world on family planning and reproductive health. And there's no way that we can speak on their behalf or pretend to, given their diversity and their excellence. But we can speak here as individuals and share our experiences with honor and hopefully represent our colleagues as best we can.
Thank you. It's all fair and all understood. It was amazing, really, to hear this testimonial in this previous panel. So for starters, let me just ask you if you could share your reactions, your reflections to what you heard from these wonderful panelists.
Yeah, I'll go first, Madeleine. So there's a lot of, I think, duality to this whole experience, to listening to the panel, frankly, to being here at ICFP. It's both heartwarming and heartbreaking for me. I think listening to the thoughtful and generous comments of everyone who spoke in the previous two panels, and just hearing the appreciation and the stories that were shared, so warms my heart because I believed in the work that we did, and it's wonderful to hear other people sort of validate that belief. And it's heartbreaking for me to consider the great losses, at so many levels. It's, I think, impossible to tell the full story of USAID's 60 years of family planning, reproductive health assistance in just the few minutes that we have, but I wanted to touch on a few of the core principles that made the USAID family planning program, in my view, uniquely impactful, and we heard a lot of it in the previous two panels. So we worked only where the agency had a presence in 41 countries, and in each of those countries, as Sheila Macharia said, we had a Foreign Service national manager who brought their technical expertise and their deep knowledge of the local context to guide how that assistance was implemented in that country. And then, as Monica mentioned, we advocated for rights-based, person-centered services and voluntarism and informed choice as a core foundation of our family planning program. We worked, not to set up parallel systems, but to, and we heard that also in the panels, to strengthen the existing health systems. We supported global goods like the Demographic and Health Survey Program, high impact practices, which I think were also mentioned, the Family Planning Visibility and Analytics Network. These were all global resources that serve the whole community and will continue to serve the whole community. And then we invested in long-term investments in research and implementation science, kind of focusing on hard to solve problems in social and behavior change, addressing complex social norms like those related to early marriage and how couples together make decisions about contraception, and the ways in which youth prefer to access services for confidentiality. And so those research investments are multi-year, and they required a lot of commitment and staying power. And then I would say finally, we love to use this talking point, and it's true, which is that USAID played some role in contraceptive research and development for every method that's currently on the market. So those are some important elements, and I think we heard them reflected in the panels, but there were important elements that I wanted to mention that to me make up USAID's legacy. And my hope is that it's not just the volume and the consistency of the investment for over 60 years, but also the approach that emphasized those things that will have left a strong foundation that the family planning community can continue to build on in spite of the really disruptive manner in which the program was ended.
Thank you. Thank you so much, Madeleine.
That was so well said, Shaimi. And I was taking notes as the panelists were speaking and thinking about my reflections here. And something that came shining through was the focus on partnerships and collaboration and building a foundation that would last. And it was heartwarming to hear that those partnerships and collaborations and foundations are lasting. Despite this massive earthquake that our entire field has experienced by the US government withdrawing its support right now for family planning and reproductive health. And the piece that I wanted to emphasize there with right now is, yes, USAID is gone. The family planning and reproductive health line item is still in the congressional budget. I know some of you are still advocating in that space. And what we're experiencing right now won't last forever, but it does mean that we need to continue pressing for the future that we want together. And I think my hope is that that approach that Shaimi was describing, that was about, thank you also, Natasha, for saying fairness and transparency, that approach for fairness and transparency, for building partnership, is an approach that everyone at this conference continues to take with kindness towards each other. And I know it's so hard in this space where the resources are so scarce and where everyone is scrambling to survive both literally and figuratively. But it's through that type of community and partnership that we'll get through this, and that we will build from the foundation, and we'll build, I think, ideally in a stronger way in the ways that Sheila was saying, with sovereignty and not over-reliance on any given partner, but a true strength together.
Thank you so much. Obviously, this Shaimi and Madeline may not be in a very good position to claim everything, but let's face it, guys, we've made some tremendous progress in development, and it is hard to think that, I mean, the USAID's role has been central. If we focus, talking about cutting extreme poverty, talking about reducing maternal mortality around the world, advancing family planning to the point where we can now afford to talk about innovation and doing that, the agency should take credit. And I know you are, but you should be proud of working for an agency that has accomplished. We can be a little shy about claiming those, but it's been huge. But there's another part to it which I want to shift our discussion toward, is the people and the foundations around the people. Can we just take 4 more minutes to talk about that? Because as we look into the future, as we look at all the challenges that we have, that we've been facing, all the backlash, all the resistance, it's going to be unprecedented. We have never been at this stage where we're going to face so much resistance to the stuff that we're doing. And we have to deal with anti-science and all of these things. And we have to rely on our people. And one of the things that the agency did is build a strong foundation around its people. So can you just share some comments around that theme,
yes,
please?
Thanks, Bob. So I know that many, many members of the broader sexual and reproductive health community have had some relationship with USAID as staff, as implementing partners, as we heard from, or in some other capacity. And I think the dismantling of the agency has impacted everyone who had any kind of relationship with the agency in some way. I do want to acknowledge that the most severe impacts of the dismantling of the agency are to the clients that have lost access to life-saving health services. And there also has been an impact on everyone who worked in the broader USAID ecosystem in terms of loss of livelihood, in terms of accusations of unethical behavior that we heard earlier in the year. I think especially of the office that we led at USAID Washington, which I believe had a concentration of the very best technical expertise in the family planning field, in almost 90 staff who were solely dedicated to technical assistance and global leadership in family planning and reproductive health. And I remain very proud of that group of people and the work that they did and their commitment to the work. And as Madeline mentioned, another 50 or 60 colleagues who worked in USAID missions, as Sheila mentioned, in daily partnership with government and local partners who were really the backbone of USAID's family planning program and really put their hearts and souls into the work, sometimes for decades, to make it responsive to local needs. And I honor them and their commitment and appreciate the contributions that they made. So I think all of us in the agency who were members of any of these groups, as well as who worked with implementing partners who were essentially our extensions into the countries we worked with, remain committed to this work. We remain strongly identified as SRH champions. And even if professionally, we've been forced to pass the baton on to others. I think our hearts remain with this work.
Yeah. So, yeah, I'm damn proud of the work that we did. Yes, yes, yes. And you know what? We're still here. The people are still here. All of us are still here. The so many people that USAID touched are still here. And it's through the people, as Pop started, it's through the people that the power for sexual, reproductive, and health and rights comes back to the women, to the families, and to the individuals all around the world. So I commend us for that, and I hope that all of you feel pride in that ongoing work and your contribution to it. And with that, I would like to take a moment, because we didn't get a chance to do this very much over the last 2025, which is for anyone who worked at USAID in January of 2025, would you please stand up and take applause? Stay standing. For anyone, stay standing. Stand up. For anyone who was working with an implementing partner for family planning and reproductive health work in January of 2025, come on, stand up with us. Please take your applause. For anyone who's a USAID alum, Monica, others, come on, stand up. For anyone who was with an implementing partner in the past and was funded by USAID, please stand up. And now I want you just to look around and think about all the people who are joining online right now as well, and all the people who couldn't be here, and see how big our network is and how many people are still here and still fighting, and let's keep fighting together.
Yes, thank you so much. Thank you. You made the point about what we were just talking about. We're all touched by these agencies. What a nice quote here. We're heroes. In fact, I picked up we've collected quotes, and I want to go ahead and read one, which I think will speak to us. Somebody said, quote, "We chose to work in SRHR to help others. That needs remain and is greater than ever. If you're feeling defeated, when you are feeling defeated, connect with your community. When you're feeling energized, connect with your communities. Our skills, our commitment, our voice are all still needed, and we need to work together to ensure we have the strength to keep being heard." This was from somebody. I don't know if we can attribute it, but I think it is it's a spirit of where we are with this. And I wanted to just maybe conclude by sharing again some thoughts on the same theme. How can we build on the wonderful foundation that this institution helped us build? How can we leverage that at a moment where we need it the most? There's not going to be any innovation if we don't get inspiration from what we've accomplished, from the understanding of the sector we have developed, and from the years of experience we have put to use. There's not going to be innovation with AI if it's not the data that AIDs created and others created opportunity gave us. So we are that community. And now, at this time, more than ever, we need that commitment, we need that being together, and we need, that is where I started, that global solidarity. That's why you're here. That's why you're excited. We want to continue to do our piece. And I want to be thankful to USAID and all the organizations that have set the path for us. But the baton is passed to us as a community of caring people. I already spoke to the special character of this community who have chosen to roll up their sleeves and engage in such difficult area of work. So let me finish by thanking you personally, each one of you, for what you're continuing to do, how you are not being blindsided by all the noise that surround us. God knows there's a lot of it. It's political, it's whatever, but this is a time for us to refocus and be proud of what we've accomplished and be conscious of how huge the task ahead is, because women are still dying, unfortunately. Children are still dying. And development, as we know it, may change. But the need to come together collectively, maybe in different ways, but in determined way, remains. So I thank you for being champions, for embracing that cause, and for continuing to fight the fight. Thank you very much.